Hi, I am Kate Glazer, and I'm here at Great Lakes Cancer Care Collaborative with Dr. Perry. So good to have you in today.
Thank you for having me.
Thank you so much. So let's talk about Great Lakes first and foremost. Talk about this amazing center where you're providing so much care to all of Western New York.
Yeah, thank you for the opportunity. The Lake Cancer Care Consortium is a relatively new initiation. We started about 4 to 5 years ago to give the opportunity for Western New York population to have an alternative and have another mode of treatment for cancer patients. We basically encounter everything from diagnosis to from screening to diagnosis to treatment, and as a multidisciplinary care for every type of cancer, as well as for the well-being of the patient themselves, which is not just cancer because of the affiliation with the big health system in town.
What sets you apart from other care centers?
I think the fact that we are part of a big health system with multiple hospitals in town, like Buffalo General, Kaleida System, Miller Firma Suburban, in Erie County Medical Center, which have a facility that serves trauma. We do cardiac surgery, we do multidisciplinary care like emergency room and urgent care, which doesn't exist in the other facilities. So we take care of the patient with cancer, not just cancer.
Absolutely. We're here to talk about lung cancer. However, there's so much passion behind what you do. What is that passion from?
Well, first, thank you. Actually, the passion is really to help patients in a way that, cancer now is the #1 killer, especially lung cancer. And I think many of these patients have the stigma, and they think because of the relationship to smoking, and many of them are actually not even looking for care because they feel that it's something that like a punishment. And we want to give access to all these patients. Say, tobacco was here many years ago. It's an addiction. It's something that it's not on the patient fault. And this patient has to be treated, especially the #1 killer. There are more patients die from lung cancer comparing to patients who die from prostate, breast, and colon together.
Wow.
And it's really not being addressed in the resources and from the healthcare as it was before.
Is there a misconception that you can only get lung cancer from smoking?
Well, it's not much of a misconception because most of the patients who have lung cancer are smokers or ex-smokers. There's a direct relation to that, but there are patients with lung cancer that are not caused by smoking. Some of them it's a passive smoker, some of it's related to environmental issues, and that's another reason, although small, but another reason for lung cancer.
How is lung cancer diagnosed?
So the best way to diagnose lung cancer is diagnosed early by screening. Now there is actually the CMS and Medicare, Medicaid, the Blues are covering screening for lung cancer. It's been done by a CAT scan, a low-dose CT scan, which is done. It's very simple. Patient come to the radiology suite. They get a CT scan. It takes about 5 to 10 minutes, and accordingly, they get a very accurate picture of what happened inside their chest or in their lungs. And if there's tiny nodules, even a couple millimeter nodules, which are maybe concerning to be lung cancer, they're being seen, and then they're being referred to specialists, to pulmonary medicine, to thoracic surgeon, to evaluate these nodules and get the diagnosis and treatment.
As far as treatment goes, what are some things that you are doing? Chemo, radiation, that sort of thing. Any other forms of treatment that you're trying?
Absolutely. So the treatment of lung cancer, it really depends on the stage. The lung cancer, when it's very early stage, the treatment will be just maybe just surgery to remove it, and that's it. There's now more and more biological therapies, and according to the gene expressions and a couple of other molecular expression, we can actually target therapy the tumors, so patient get medication as well as removing the cancer as well. So you talk about chemotherapy and radiation. Usually these treatments for more advanced. So let's say a patient, we found lung node or lung cancer. We operate this patient at the same time, we're removing lymph node and removing the tissue in a way that the pathologists, the people who actually check the specimen that comes out of the patient and see how advanced is the tumor. And if it's more advanced, if it's larger than we expected, or there's a lymph node involvement, the patient will get, it's called adjuvant therapy, will get more therapy, which is chemotherapy, sometimes immunotherapy, biological therapy. And some of the patient, when it's fine in a little more advanced way, are getting the treatment as a called sandwich therapy. They're getting the treatment of immunotherapy or chemotherapy before, getting surgery, and potentially getting after that more treatment in order to cure them from lung cancer. Well, Great Lake Cancer Care is a collaborative, and it's involved of many specialists who are highly skilled in what they do. And the advantage is that we are everywhere, meaning we're in all hospitals around Buffalo. We have ECMC, Suburban, Buffalo General. We have clinics everywhere in the North Town and the South Towns. We are available for our patient 24/7, and we have all the emergency facilities, including our emergency room, to treat the patient, whether they have cancer and their problem is related to the cancer, or they have something else, but they were treating in our centers, always for our patients.
Thank you so much for joining us today, Dr. Perry. It was very informative, and we appreciate what you do here in Western New York.
It's a pleasure. Thank you very much.
Thank you.
Well, viewers, you can learn more about Great Lakes Cancer Care by heading over to their website at greatlakescancercare.org.